Hi, and welcome to Fairview Range Focus. I'm David Hall, Senior Vice President here at Fairview Range. Now, today you might notice we're in a little bit different venue than what you're probably used to if you've seen our program before. The HPAT staff are doing some redesign of their studio, and which is very exciting, moving to a digital format. So we're actually today in one of our hospital offices here, so hopefully that'll work out well for us. But thanks for joining us, and I'm excited to welcome Dara Swanson, who is a nurse practitioner with our disease management program. So welcome.
Thank you.
It'll be fun to talk about disease management. I know you've got a lot of things going on down there.
Yes.
So why don't we start and maybe tell us a little bit about the disease management program and exactly what that consists of.
Within the disease management program, we offer a diabetes resource center. We offer Coumadin, wound care, ostomy care, and then also we're going to be developing or restarting a heart failure program too.
Okay. So why, when you say, some people I know think when they hear disease management think, oh, that's something really bad, that I have a disease, but yet, can you help us kind of understand that?
Yeah, it is, in conjunction with their primary care providers, we work with them to offer more services for those type of chronic diseases. So, for example, for diabetes, we get a referral from their primary physician, and then we are able to offer some additional resources, classes that help that individual or patient to gather the tools necessary for them to help manage their diabetes.
Okay.
With the wound care, again, same thing, we need a referral from their physician or primary care provider, and then we can offer different dressings that are available out there to help make those wounds heal. Mm-hmm. For Coumadin, we, with doing the INRs, we can manage them if there's certain surgeries that are coming up, certain, medications like antibiotics that they're put on. Again, we can follow those INRs or their coags to make sure that they're therapeutic still. And then as far as with the heart failure program, again, that was started about 2 years ago by Jan Canuti. She's a nurse practitioner over in Mountain Iron at Fairview. It just kind of fizzled a little bit, and now we're restarting it again. Okay.
So when someone hears a disease management program, they shouldn't probably look at it as like, oh my gosh, I'm going to die.
No.
No. There's just the term disease, I think, sometimes causes people to kind of say, whoa, what is that all about? But it sounds like it's really a good thing.
Exactly.
From an education standpoint,
yep.
Learning to live, with the condition or disease that they might have. Okay.
Exactly.
Good. And tell us about your role. What do you do exactly in the department?
I work with diabetic individuals. I also work with wound care individuals, and then starting with heart failure. The other thing that I failed to mention too is we are going to be doing have been doing the Medicare Wellness Exams, including the initial one and then also the annual Medicare Wellness Exams. Okay,
so as long as we've touched on that, let's maybe talk about that a little bit further, the medical wellness exams. Now, what exactly is that? Is that something that anybody can get a wellness exam, or?
It's for individuals who are on the Part B Medicare.
Okay.
And this doesn't take or replace the annual exams that they have with their primary care providers. This is just on top of, it's something that Medicare offers. It's free unless there's any co-pays that the person has to pay. But what it is that, yes, it's a preventative wellness exam. The first one, the Welcome to Medicare exam, that is usually done within the first 12 months that they've signed up for Medicare. The annual Medicare wellness exam is something that can be done yearly, therefore. And what it looks at is, we go through their height, weight, their BMI, look at their dietary, make sure they're up to date with their immunizations, with their preventative exams like mammograms, DEXA scans, prostate screenings, colonoscopies. So again, just to make sure everything is up to date, and then, just talk about the wellness of the patient.
Okay, and they can have that done on an annual basis?
Yep, they can have it done. Yep, it has to be 12, what do they say, 12 months after that initial one. So
Okay.
it has to be, like a yearly thing.
Okay, and now I caught a word there. Everyone may be familiar with. What's DEXA scan?
DEXA scan. It is a procedure that determines like how at risk you are for osteoporosis.
Okay.
Yep.
Okay, so is that I think sometimes people maybe refer to as a bone
Yeah,
density
like a bone density
or
scan.
something?
Exactly.
Okay.
Yep.
All right, good,
Yeah.
good. All right, let's talk a little bit more about diabetes.
Okay.
And if I'm not mistaken, the Diabetes Resource Center, maybe is that the longest serving disease management program?
Yes.
It's been around a long time.
Yes. Yeah.
Okay.
Don't quote me, but I want to say it's been around for at least like 9-10 years.
Yeah.
So,
I know it's been quite a few years. Okay. So is that, how does someone who's newly diagnosed, do they get referred to that program, or is it for only people who have had diabetes for a long period of time? How does that work?
Yep. Again, it is driven by the primary care provider as far as with getting a referral. And yes, regardless if you are newly diagnosed or have had diabetes for a long time,
Okay.
we do have classes that kind of cater to that patient. So when they're newly diagnosed, we have the Basics 1 class. And so it is a 3-month, it's 4 classes that are over 3 months. And it gives, you meet with the diabetic educator, also with the dietitian, and just kind of, like I said, give you the tools necessary to help manage your disease.
Okay. Go ahead.
Okay, that's okay. And then there's other resources out there. We have a pre-diabetes program. We have an insulin pump program for individuals who are type 1 diabetics. We also take care of pregnant people who have gestational diabetes.
Okay.
So, but yeah, it offers a lot of different services out there. The other thing that it does offer is that we have a support group that meets once a month. I believe it's like the third Tuesday. If you want to look on the website at Fairview, it does give you the topics and the times, but it's a free support group for individuals who have diabetes.
Okay. Well, and from what I understand with diabetes, there's so much to do with education as far as being able to understand what one can, what they eat and how much they can eat and so forth. So it sounds like the education is a big part of the program.
Exactly.
Okay.
Yep. And currently we have 4 certified diabetic educators. Their names are Jana and Nancy. They're registered nurses.
Okay.
And then we have 2 of the registered dietitians, Janelle and Becca. We also have another nurse who is earning her hours in order to sit for the certification, as well as with me being a nurse practitioner, but I too can sit for the certification. I just need to get enough hours.
Okay.
Or contact hours for the patients to do that.
So being a certified diabetes educator, it isn't just a title we give to just anybody just because they work in that department. They really have to earn those credentials and training-wise.
Exactly.
Which really speaks to, I guess, the quality of the program as far as that they are really skilled and educated in what they're doing. So, because I've heard just great things, and I've had some personal experience with a relative who has diabetes, and I think even to the extent where sometimes the physicians will call to get some direction or the thoughts or advice from the diabetes resource educators, right? So that happen frequently?
It does, and being a primary care provider, you see a lot of patients, and so you might not necessarily have the time to meet, and we have the capability of sometimes meeting weekly with these patients to, tweak their medications, and then, have them come in and have their meters or their blood glucose meters downloaded just to kind of see, is the treatment working? If it's not working, what can we do differently? That kind of brings me into the next thing that we offer there is called the Continuous Glucose Monitor Study.
Okay.
And so what it is, we actually have 6 sensors that we can place, not necessarily 6 of them at a time, but 1 sensor is placed on the patient's abdomen.
Okay.
And when I tell people, it's almost similar to like when you go to the hospital and you have a catheter placed. It is like a centimeter catheter that's placed in the subcutaneous tissue of your skin.
And that would be just
a little, very,
little bit into the skin?
yeah,
Okay.
very tiny. It's a little bit of a poke because there's a needle involved, but then we take the needle out, and most people cannot feel it afterwards. But what's unique about it is that it senses your blood sugar every 5 minutes.
Oh.
So instead of getting the snapshots in time for when people do their finger sticks, actually, it's like a movie of their blood sugars. And we have them wear it for at least 72 hours. They can actually wear it up to 6 days. All we ask of them is just to take their blood sugars 4 times a day because the system needs to be calibrated. And then they keep a log of their food and then any medications that they take as far as with diabetics.
Oh, that's really interesting.
Yeah, and it is very helpful because it really tells us, are they blood sugars are just high across the board? Is it certain meal times that they're having issues with? It can really help drive where to tweak the medications.
So is that something you use for people who are newly diagnosed, or is it just ongoing depending on their condition or whether?
Exactly.
Okay.
Yep. So if they, diabetes is a progressive disease, and so you could be spot on with your exercising, you could be spot on with your diet, and it just progresses to that next level. And so that is the perfect time to do a study.
Okay. Oh, good. Is that a newer development?
Yeah, it's relatively new. I think we've had it in the department for a couple years now.
Okay.
We were kind of limited because we only had 4 of them, and because we can essentially do like once a month, we don't necessarily do that. And so there was a big waiting list, but we just got 2 more sensors this year, and so now that has really helped.
Okay. Is there an age restriction as far as the age of the individual that can receive services from Diabetes Resource Center?
No.
So pediatrics
Yep, exactly.
to adult?
Yep. Nancy, she is insulin pump trained, and so she handles a lot with our type 1 diabetics, and yes, she has children that she sees up to age 99 plus.
Okay.
So.
You just commented on it, and I hear it frequently too when people talk about type 1, type 2 diabetes.
Yes.
Maybe could you help us understand kind of, what's that?
Yeah.
What's the difference between the two?
Yep. Type 1 is a person that doesn't make any insulin, and so they need to take insulin in order to live.
Okay.
Type 2 diabetes is just that your pancreas just can't keep up with the needs of what your body is doing. So you're still making insulin, but just not enough.
Okay.
So.
All right. Well, that's interesting. So wound care. Let's maybe move on to that.
Okay.
Wound care, and maybe first of all, exactly what kind of wounds, and how does someone develop a wound that would have to be taken care of?
Okay. Wounds can vary from traumatic wounds up to chronic wounds. Myself, and then there's Twyla and Paula. They're certified wound ostomy nurses.
Okay.
And so all of us have attended the classes at Web Walk down in the cities, which is a wound ostomy class that, we've learned, what causes the wounds, how can you treat the wounds, how you can prevent the wounds. And so, we see a variety of individuals that, it could be, after an accident where they have like a traumatic wound versus someone who has chronic venous insufficiency, meaning that their veins aren't working appropriately, so they have issues with swelling in their legs. And as the tissues are swollen, they're taut, takes one little bump on a table, and sure enough, there's a wound.
Okay. So, is there a correlation between diabetes and
Yes.
wound care?
Yes.
Okay.
Yes. So yeah.
Yeah. Tell us about that.
We do. Yeah. That's one thing that I not necessarily like about the job, but yet, yes, I do see I can do, as I say, kill 2 birds with 1 stone. Unfortunately, with diabetes, what can happen is that you can develop neuropathy. So you're not feeling sensations that you typically do. It's like a numbness and tingling.
That's what neuropathy is?
Yep, exactly. Yep. So what can happen is that, there's various stages of neuropathy where you have numbness and tingling to the point where you can't feel anything. So I've seen multiple patients who have stepped on something, not realized it, and sure enough, they develop a wound. And then with having diabetes, just things can cause havoc quickly. Especially if they don't even realize that they stepped on a nail or a chunk of glass, and then sure enough, that can cause problems.
Is there special treatments that you use for wound care? I mean, to try to accelerate the wound healing and so forth? What tell us about that?
There's a variety of products out there. 2 of my favorite that I like to do, there's actually honey-based dressings. Honey's actually antimicrobial, and so it can, if there's any bacteria brewing in the wound that's causing delayed healing. It helps kill off that bacteria.
And it's real honey that's used.
It's medical honey, yes.
Oh, I've never heard that before.
Yeah,
Sounds
yeah,
delicious.
yeah. So it's not the table honey that you have on your, but yeah, but yep, it's medical honey, and there's a variety of honey products out there. Another type of product is silver. So it's silver infused dressings, and again, silver is antimicrobial. So again, too, kind of depending on what your wound looks like. If it's dry, you need to add moisture. If it's moist, you need to wick it away. So it's kind of that balance of to aid in wound healing.
Okay. Maybe it's kind of a dumb question, but I mean, if a wound that doesn't heal on its own, it can be a nuisance, clearly.
Yes.
But is there other concerns? I mean, as far as why an individual would go to the extent of coming into a program to have a wound healed, and what might happen if they don't, if the wound doesn't heal?
Yeah, and so when a person comes in with a chronic wound, let's say a wound that's like been there for 2 to 3 months or plus, we look at all the factors involved. Is it due to increased swelling in their legs? Is it due to bad circulation in their legs? We look at maybe doing a wound culture, because what can happen with chronic wounds is that bacteria, granted the person doesn't feel infected, meaning like symptomatic with fevers, chills, but yet wounds can get chronically colonized, and so we do a wound culture to see if there's any bacteria growing that is delaying healing. The other thing that we look at too is, what other factors are, causing the wound not to heal. So, and we try to fix them or try to help, if it is a wound, if they have good arterial supply and it's more related to edema, we can do compression wraps. We have a variety of compression wraps out there. The other thing is that, let's say it's related to arterial flow. So we send them to ultrasound. They do an ABI, which is an ankle brachial index, and it shows how the blood flows to that extremity. And if it's below the 0.7 or less than normal, then we can send them to the appropriate services to help, get them revascularized, or, send them back to their primary and see what direction needs to be taken.
Okay. I've also heard some mention about use of negative pressure.
Yes.
For wound treatment. Tell us about that. What is that?
Yep. So it's negative pressure wound therapy, or a wound vacuum. And so in conjunction with several of our surgeons, Dr. Hansen and Dr. Williams, if there's any like abdominal wounds that aren't healing, or thinking of any like coccyx wounds, sometimes even leg wounds, again, it's kind of direction of their primary care provider or the surgeon. But it's an apparatus that is about this big, and what it offers is a continuous pressure, or a vacuum, or a negative pressure. So it's like a vacuum that helps wick away drainage and then also stimulates cell growth. Oh. And so if it's a deeper wound, we want it to heal from the inside out, and so we do that type of service to help promote that healing.
Okay.
So.
Good. Well, it sounds like lots of different
treatments. Yes, there is a lot of different treatments, exactly.
I suppose it's really based on the individual and their personal condition or state.
Yep.
Okay, good. So. Then, how about congestive heart failure? And I know you mentioned that.
Yeah.
But maybe help us understand exactly what is congestive heart failure.
Yeah, so again, look forward to some publications about it restarting again. Okay. Like I said before, 2 years ago, it was initiated. But the big pull now is that down in the cities at Fairview, they have the Heart Failure 2.0. And so they're trying to kind of standardize their treatment plan, and so that everyone will use like a standard, like a congestive heart failure set. So what is heart failure? Heart failure is when your heart doesn't pump efficiently or effectively, and so it can create a lot of problems. I
think sometimes when people hear the term failure, it is it stops.
Doesn't
necessarily mean that their heart stops. Right?
Exactly, perfect. Yeah, it doesn't mean that your heart's not beating. It just means that the pumping mechanism is not keeping up to your body's needs.
So it's weak, maybe. That term might fit.
Weak, stiff. Yeah, there's certain conditions out there that can contribute to it.
Okay. And are there, so there is treatments that are specifically for that congestive heart failure for the,
Yep.
to improve the blood flow or
Yep,
increase?
exactly. There's different types of heart failure. So there is, and I won't get into all of them,
Okay.
but there's 4 of them. There's a left-sided, a right-sided, a diastolic, and a systolic. And like I said, we could spend all day talking about that, but I won't.
Okay.
But kind of depending on the symptoms of the patient. But yes, there are different treatments out there versus medication. Surgery, but again, kind of relating to diabetes, lifestyle modification. So taking your medications, making sure you're not missing anything, reducing your sodium intake, doing daily weights, checking to see, how you're sleeping at night, because when people who are in failure, first thing that they might notice is that they can't lay flat on their back because they are coughing or they feel like they're suffocating. So,
Okay.
but yeah, so part of this program is yes, education is key. They actually have a stoplight. It's something that they can put on their refrigerator, but it's red, yellow, green, and asks a variety of questions regarding their weights, regarding how they're breathing, regarding if they can lay down to sleep, the swelling in their legs. And if they're in that yellow or in red, that's when they need to call their primary care provider or us.
Good. So as you talk about some of these different disease management or programs, it sounds like one thing I keep hearing has to do with diet. Now, is that my imagination or is that true? Is that
Yeah.
really a factor in everything? Okay.
Exactly, it is. Yep. And so with the heart failure program, what's going to be nice is that the Coumadin ladies, Mary, Joe, they're going to be helping with that education piece of it, as well as the registered dietitians too, because there's hidden sodium everywhere, And so one thing that's nice in the book that we're going to be using, the same book that they use down in the cities at their core clinic, is that, it talks about different foods that are considered high sodium, moderate sodium, or low sodium. So, for example, like bacon. Unfortunately.
Yeah, right.
So, but
all the good stuff.
All the good stuff,
Yeah,
right?
yeah.
Yep.
Okay.
And then it talks about alternatives too, taking that salt shaker off the table and doing different alternative spices and that.
Okay. So it's not just, it sounds like you can start with some basic things like that that the patient can do themselves to improve their condition. It's not just, it's the drugs.
Exactly.
But there's things to really do at home and
Exactly.
Okay.
Yeah.
Good. And that's all part of the education.
All
I'm
part of
sure.
the education, exactly.
Okay.
And then we're developing like a monitor system, because the biggest thing is daily weights too. If they have more than a 2 to 3 pound weight gain in a day, they need to be more observant to make sure that they don't, go into.
So thinking of the whole program overall, and whether one might have congestive heart failure or diabetes, it's all outpatient, is that right?
Yes.
All outpatient programs?
Yep.
Which means what? It means that maybe you can help just some people might hear that term and think, well, now, what does that exactly mean?
Yep. So outpatient is, we have them come here to our department, and then making appointments with our scheduler. Like I said, first of all, we have to get that referral from the primary care provider, and then have them meet, and we try to coordinate, if they are going to meet with a dietitian, so not having to come 3 times a week, kind of collaborate that.
Okay. So just scheduled appointments, but when they're done, they're going home. There's not
Exactly.
a bed involved.
No,
staying overnight.
No.
Okay.
But I do want to say too, with the diabetes and also wound care, we do get referrals on the floor or in the hospital, and so if it's an inpatient, sometimes when they're newly diagnosed with diabetes or like a type 1, sometimes we try to get them to see them here first in the hospital, just to kind of establish that relationship.
Okay. And just to be clear, so it sounds like that the entry point really begins with the primary care physician.
Exactly.
So if anyone is interested, or that's really where they need to start, talk to their family physician or primary care provider, and start with there, so that referral comes from them. Is that right?
Exactly.
Okay.
Except for the medical wellness exams.
Okay.
Yep.
Yeah.
So if they want to schedule that, Emily is our scheduler.
Okay. And they can call just directly.
Yep.
Okay.
Yep. They can. Good. Yep. They can call the hospital, but ask for the disease management.
All right. Good. I think we'll probably get those numbers up on the screen so
Yeah.
people can see that. And I also know you've got some brochures.
Yes.
And I think we'll get those on screen too, so people can see those and learn more about it. No doubt, if they came into the program, they can get one of those brochures
Yes, for
themselves.
sure.
So very good. All right, wonderful. Well, Dara, I really appreciate your time. I think we're just about out of that.
Okay.
So we'll wrap it up, but grateful for your time and your expertise. And I know you've brought a lot to the program, and so it's great to have you on this, our organization and our team as well. So thank you. It was fun to talk about the disease management. Hopefully you've learned a little bit about the services we offered, the different programs. And so we thank you for joining us today. If you want to learn more about the disease management or other services that we offer here at Fairview Range, you can go to our website at www.range.fairview.org. So thanks for joining us. Watch next month for another filming of Fairview Range Focus, and thanks for watching.